Now, one thing that I'm passionate and very excited about is creating awareness. And November is National Diabetes Awareness Month. And over the course of the weeks, we've discussed symptoms, we've discussed signs of diabetes. We've also discussed the health consequences of nerve damage. And when we talk about nerve damage, we talk specifically about the feet. Now, a lot of people don't understand how nerve damage, and especially the feet, is associated with diabetes, or even how diabetics can walk around for weeks and even months without knowing that they have nerve damage in their feet. And with us this morning, Fransa Katz, our PnP Pharmacist, and also Sister Marlene to join us to speak about the care of diabetics and diabetes. Morning to the show, and welcome to the show, ladies.
Thank you.
Morning, Sister Marlene. Welcome back. What is nerve damage? You know, how does it manifest in the feet?
Well, in diabetics, especially where they have real problems with their sugar levels, it can cause, and if it's uncontrolled, it can eventually, over a period of time, cause the nerves to become less sensitive, the nerve endings, and that you find most of the time in the feet. Also what happens, the diabetes affects the blood flow from the legs to the feet as well. And they can actually step in something or cut their foot and not know that it happened. And that is where the problem comes in.
I've known two people where they say, the toe's been affected and they have to have it cut off. Or, you know, I've met a lady who has half a leg because the actual consequences of dealing with the foot infections itself, what are the consequences, sister?
Because of diabetes, it takes longer to heal.
Okay.
So infection sometimes doesn't clear up at all, and that's when gangrene sets in, and then we have to do an amputation.
Wow.
So it's the problem of controlling the sugar so that the foot can heal because of the circulation. The blood flow will be better if it's controlled. So the healing process will take place. But if your sugar is not controlled, then obviously it won't heal properly.
Now, you're speaking about control. How does one keep this condition under control?
You have to check your sugar regularly. You control it with either, you look at what you eat, and then often doctors would prescribe tablets, and if the sugar control is not very good, you might go on to insulin. But the important thing is to continually check your sugar to make sure that it is within the right level, that it's not too high or not too low.
Now, our PnP clinics are doing screenings as well to make sure that we're all in place and intact. Now, I've got a guinea pig because I want to see how you actually... Ewan, kom ga in. Kom, Boeta.
He's always our guinea pig.
Sister Marlene, help us out. So how do you do the test?
Interesting, yeah.
Yeah, how do you... Look, he's got...
You know what? I just got it right because I saw this.
No,
it's not a needle.
Is it not a needle?
No.
How do you test the actual feet? So show us what you do.
First of all, you take the history, amputation, any previous problems, and you check for cracks and ingrained toenails. That's the basic that we do. We check for the pulses. There's 2 pulses on the feet, and we check if that pulses are still present.
Okay.
I'm sorry if my feet are a little bit sweaty, but I'm nervous.
Can I?
It's not a needle.
It's not a needle. Just relax. Just relax.
Okay, no, I'm just showing off.
So,
look at that.
Sit still. What we do is we check this if there's any sensation.
Do you have sensation, Ewan?
It's just
What? No.
when you feel, you must tell me if you can feel.
Okay,
this
I'll tell you.
Not look.
I have very thick feet, like strong feet.
So
I feel a little bit of pressure. Yeah, got that. Got that. Got that.
This is so interesting.
Yep.
So you literally you prick it.
Well, tickle me there.
It's not a prick. It actually
looks
like.
And then you do one on top as well.
Just there, yeah, just
okay.
there.
So I felt every single one of those.
So are you saying that someone with diabetes would not have felt it?
They wouldn't have felt it. And then we have to use a thicker one to go over it again, but we have to refer them. In that case.
Thanks, Sister Marlene. Thanks, Ewan, for being our guinea pig as well.
Again.
Our screenings, where can we do them? At PnP?
At PnP, and also for the month of November, we have a wonderful special on a machine that you can buy yourself from the pharmacy, plus 2 sets of strips, so that you can test it at home, which is the best way to control your sugar, for 220 Rand.
Okay, well, exciting
stuff. So you can come buy that at PnP Pharmacist.
Okay. Well, make sure you get to our PnP Pharmacies and have it checked out. But we're creating awareness all over and making sure that we're all informed and know what this is all about. Diabetes awareness and the month of November, but also here on your Feel Good Breakfast Show. This is Espresso.
Goodness can be found in encouraging greatness at the Junior Runners Academy in Soweto. Pick n Pay, always there for you.